Okay, do you would you mind saying a little bit about your organization?
Yeah, of course, not at all. So the Psychology Student Alliance for Research was created back in 2019. The purpose of this organization is to help students become more aware of the research opportunities that are offered at the university at UTRUB, to help them get into research labs, to help them with graduate schools, master's and PhD programs, help them build resumes, CVs and letters of recommendation, how to ask for them, and pretty much just everything related to research. Um, and that's pretty much our
Okay.
focus right now.
So it's kind of specific to research, no?
Yes.
Okay, so why, since there's very few people here, why don't you guys introduce yourself and say something about who you are and where you're at? You want to start, Jocelyn? Is Jocelyn there?
I think she is, but she did mention to me that her mic was not working, so she might just be typing it in.
About Fabiola?
Uh, yes.
Hi, would you like to introduce yourself and say a little bit about yourself?
Well, like I'm a special education major, and my minor's in psychology.
Okay. And what year are you in?
I'm my fourth year, senior.
Okay, so you're graduating, right?
Yeah, I need another year to graduate.
And have you been doing any research at all?
No.
No, but you're interested in research.
I am.
Okay. Well, thank you. And Haley?
Hello, my name's Haley. I'm an undergrad. I'm a junior. I'm majoring in psychology with a minor in addiction studies. I currently serve as the secretary of SAR, and after graduation, I plan to go to master's school or grad school to get my master's degree in clinical rehabilitation counseling. That's my idea right now so far. I also just joined the ACT lab. It's my first research lab that I just joined, so I'm really excited about that. My research interests are include like trauma and substance abuse among the LGBTQ population, as well as the homeless populations. Yeah, that's just a little bit about me. Yeah.
That's very interesting. Thank you.
Thank you.
And Brittany?
Yes, hello, my name is Brittany Hernandez. I recently graduated from the psychology department of the undergrad. My minor's in Asian studies, which isn't related at all, but yeah. Currently I'm applying to grad school as well there at UTRGB for clinical rehabilitation counseling as well. I barely started research on my own. Right now I'm trying to replicate a study, but I'm barely starting on it right now. About anxiety sensitivity affecting burdensomeness. My main interests for like clinical rehabilitation counseling is mainly with children with disabilities as well as people with chronic pain and chronic illnesses.
Okay. And Jocelyn, did you fix your mic? No? Okay. Okay, so let me start. I guess there's very few of us, so what I'm gonna do is I'm gonna tell you a little bit about myself, where I'm from, where I come from, my educational background, and then my experience as a psychologist since I received my doctorate, and then a little bit about my research. And after that, Gabriela Antiveros, who is here with us, and is in my lab, is going to talk about the research that she's done since she came to our lab. Um, and I'm free, also open to us answering any questions that you might have. Okay. Okay. First of all, I'm Dr. Arthur Cantos. I'm a professor in the Department of Psychological Science, and I'm also the director of the director of clinical training of the PhD program in clinical psychology at UTRGV. And I'm also the director of the Family Violence Lab, which is the research. You probably know very few people, if any, from my part of the world. Okay. I assume you've never met anybody from where I'm from. Okay. And this is where I'm from. Okay. It's the southernmost tip of Europe. And it's right opposite Africa. It's right at the end of Spain. It's a British, it's a British independent territory from at the southernmost tip of Spain. Okay, so we have a frontier. We are like a border town, like you guys. Yeah. So we have a border with Spain. Okay, we have we cross the frontier to go in and out every day, and this is Gibraltar. Okay, the Rock of Gibraltar, and you can see an ape there. We have lots of those. They're roaming around the rock, and they sometimes go into the town, and they go into the houses through people's windows, and they steal stuff. Okay, they're famous, the Gibraltar apes. Okay, it's the legend is that they came from Africa through a tunnel, an underground tunnel um, under the ocean. So Gibraltar is opposite Africa, and it's where the Atlantic Ocean meets the Mediterranean Sea. Okay. Anyway, so that's where I'm from. I spent the first 15 years of my life there, and then I went to England. Okay, my academic experience, I studied in the Gibraltar Grammar School in Gibraltar, which was a Christian Brothers school. Until I was 15, and then I went to London, and I did the last 2 years of high school in the Hammersmith College for Further Education in London, England. From there, I went to the Universidad de Valencia in Spain. Okay, and that's where I did my 5-year degree in psychology. In Spain, it was a 5-year degree. And I did philosophy with specialization in psychology. Okay. Then I went back to England, and I did a diploma in behavioral psychology, behavioral psychotherapy at the Middlesex Hospital Medical School, University of London, England. And from there, when I was at the Middlesex Hospital, I met a psychologist from the University of Stony Brook who had come to visit, and he asked me if I wanted to do an internship at Stony Brook. So I said yes, and I came to the US, and I did an internship, and then I stayed on to do the PhD in clinical psychology at the State University of New York at Stony Brook. That's my academic experience. Okay, so I think, and then I did a postdoc as well. When I finished the PhD, I did a postdoc in family violence for 2 years also at SUNY Stony Brook. Whilst I was studying my PhD at Stony Brook, I also I needed money, because obviously students are broke. So I needed money, so I found a job at the University of Columbia in New York City. And I worked at Columbia Presbyterian Medical Center for 5 years in the family center. That's where I started working in domestic violence. Okay. And that's, I use the population there at Columbia University Medical Center. I use the population there to do my PhD, my doctoral dissertation, which I did in coping strategies of child abusing mothers. Okay. I used I got my participants from the family center where I was working. Okay. If you have any questions, feel free to ask me. Once I graduated, I I worked at the Stony Brook University Marital Therapy Clinic part-time. And in addition, I started working in foster care at St. Christopher Elderly Services for Children and Family in New York. St. Christopher Elderly Services for Children and Family is the largest foster care agency in New York, in the New York area. I started to work at a group home for difficult to place children. So that they were from the ages that range from 12 to 18. And it was, they had 9 children in a group home, and I did clinical services, therapy with them. And I also worked with developing a behavioral system for the group home, so that the carers would be able to manage the children. Okay, so we implemented a level system. I don't know if you're familiar with what a level system is, which basically we gave the residents different rewards at each level that they were at, depending on the way that they were behaving, and how they were doing at school, how they were doing in the home, etc., etc. So each level got increasing independence. Okay. The highest level, you basically came in and out of the home as you pleased. Okay, as long as you respected the and you were responsible and respected the rules of the home. Okay. So it's a very behavioral system. So I did that, and in addition, I worked with foster children in foster care, not in group homes, and I did individual therapy with the foster children, and these were children that had been abused. They were victims of physical abuse, sexual abuse, or neglect, and they had been removed from the home, from their home, because of the abuse or neglect that they had suffered. Okay, most of the children were never went home, and they were basically released. Their parental rights were terminated, and they remained in foster care. Some were adopted, others were not. Okay. I worked with them. I worked with the foster parents as well, trying to help the foster parents manage the kids and behaviorally. And also I worked with the carers. Okay. I also worked in therapeutic foster care. Therapeutic foster care is for kids that have had serious difficulties and exhibiting some psychopathology, and they are placed in special homes where the foster parents are trained to address those needs. Okay. In addition to doing the therapy and helping the foster parents, at some point I decided that I needed to do some research. So what happened was that I tried to persuade the childcare workers to try to work with the parents and to facilitate the reunification with the child and the parent. But what happened was it was very hard to get the carers the childcare workers to try to help the parents and to reunificate with their children, primarily because the childcare workers were kind of horrified by the kinds of abuse that their kids had experienced, and they thought that they should not send the kids back home. So what I did was I did a study to look at the effects of parental visitation on the kids' behavior. And I was able to show that the children that were visiting with the birth parents were, were doing better behaviorally as rated by the foster care and the teachers than the children that were not being visited by the foster parents, by the birth parents, sorry. So that was used as a policy by different states to basically try to get foster care agencies to promote visiting with birth parents whilst the kids were in foster care. So that's one way of using research. This is a research organization, right? You're all interested in research. So research sometimes can help you influence people and to promote to promote the service delivery that will help children or other people. Okay, so if you try to convince the childcare workers and that doesn't work, then you can always use research to convince them, and that worked. Okay, so at the same time as I was working for St. Christopher, so these services for children and family, I also started to work at Suffolk County Department of Community Mental Hygiene. That was a community community mental health office, right? And we saw primarily people that were that has serious mental illness, like schizophrenia, bipolar, etc., and also children that were traumatized. Okay, and I did that, I think, for 10 plus years. Okay, during my stay, my work there at the Suffolk County Department of Community Mental Hygiene, I also did evaluations for people on that had been placed on probation, like post-sentencing evaluations, to determine what their psychological needs are. And I saw all the criminals in Long Island, I think Suffolk County, Long Island, and I did hundreds of evaluations during my time. I also worked at a pain management clinic with people that had traffic accidents. Okay, and I did biofeedback with them. I also had a private practice at Stony Brook, where I saw people that were suffering from that, like mostly the worried well. What my my chief medical officer in Gibraltar said classified them as a worried well, which are people with mostly anxiety and depression. Okay, and people that had marital problems. Okay, and then after a while, I decided to leave New York, and I got an offer to work in Gibraltar, and I was hired as the director of mental health for Gibraltar. I mean, I didn't know Gibraltar is an independent territory of about 34,000 people. But since it's isolated in that we have a border with Spain, we have to provide all mental health services to the people of Gibraltar. There's nowhere they can go. So we had an inpatient facility where we had an acute ward and a long stay ward. The acute was for people with acute schizophrenia, bipolar, mostly schizophrenics and bipolar, and some borderlines people. And then we had about 80 nurses in the system that I managed. Then we had an outpatient mental health service in primary care. We had a service for children. We had a developmental disabilities service. Okay, and we had a service for people that were released from the hospital and were maintained in the community. And we had about, I don't know, about 5,000 people in that, managed by the nursing staff and the psychiatric and psychology staff. Okay, so that's basically the mental health system in Gibraltar, and I did that for 4 years, and then after that I went to Chicago, and that's when I started my academic experience. Whilst I was in Chicago, I also worked at the Anxiety and Agoraphobia Treatment Center in Northbrook, Illinois. It's a private that was a private practice where we did behavioral treatment like exposure and response prevention for people with obsessive compulsive disorder, and exposure for people with panic disorder. I would spend a lot of time going up and down the Illinois freeway and trying to help people that have difficulty driving because of their panic. Okay. So I went to Illinois. It's right outside Chicago. It's North Chicago. And I was director of clinical training for the PhD program in clinical psychology at Rosalind Franklin University of Medicine and Science. And I did that for 6 years. Okay, then after that, I was program director at the PhD program in clinical psychology at the Universidad Carlos Albizu in Puerto Rico. And I did that for 2.5 years. And then after that, I came here to be director of clinical training for the PhD program in clinical psychology, and to start the PhD program in clinical psychology, which we did. And we now have 2 cohorts, and we are admitting the 3rd cohort this year. Okay. Any questions so far?
I do have a question. Why did you decide to come here to the Valley,
Because
to UTRE?
because I wanted to start the PhD program in clinical psychology, which is the first bilingual PhD program in clinical psychology in the country, in the US. So that I was interested in doing that and helping to develop this program. That's the primary reason I came here. Okay, this is my interest in developing a bilingual PhD program. I'm bilingual. I've been bilingual since birth. Gibraltar is bilingual. It's very similar to the Valley. It's we speak Spanish and English. We mostly speak English at school and Spanish at home. Okay, and in the street. So I mean, it's very similar. And I have an interest in working with the Hispanic community. I went to Puerto Rico. Puerto Rico is also a Hispanic community. It's part of the USA, but it's Hispanic. Okay.
Mhm. Do you ever think about going back to your hometown? Do you ever wish to go back?
Well, I went back when after New York. I went back and I was director of mental health there for 4 years before I came to Chicago.
Mhm.
So I did that. So I spent 23 years in New York, and then after 23 years in New York, I went back to Gibraltar. So I go back frequently,
Oh,
uh, like once a year, at least pre-COVID. Okay. Okay.
yeah,
So,
that's
well,
it. Thank you.
any other questions? No. Okay. So then let me talk to you a little bit about my research. Okay. When I went, I have always done research throughout my career. Obviously, when I wasn't in academia, wasn't able to do as much research as I have done now. But I published a couple of studies in intimate partner violence in the 90s when I was also working as a clinician. Okay, and then I published a few studies in foster care and child abuse. Okay, whilst I was working as a clinician in foster care. I published my dissertation as well, and that study, that publication has gotten a lot of citations on coping strategies of child abusing mothers. Okay. Since I came to Chicago, I came back to the US after Gibraltar. The first study I did was a longitudinal study of male perpetrators of intimate partner violence on probation in Lake County, Illinois. We followed 457 probationers that had been placed on probation for perpetrating violence against their partner. We followed them up for 5 years. Okay, so the probation was 3 years and then 2 years past probation. The perpetrators had participated in a treatment program. Okay, so we compared those that completed the treatment program versus those that did not, and we looked at recidivism rates. Okay, and that study was published 2 years ago, close a year and a half ago. Okay, and we looked at the recidivism rates of generally violent and family-only perpetrators, and I'll talk a little bit more about that, about the results later. Here, I'm completing a study assessing hormones, testosterone, cortisol in male perpetrators of intimate partner violence on probation in Hidalgo County, which Gabriela has been helping me a lot with. Then the lab studies that we have been doing, one study is assessing dating balance in high school students in the RGB, which was done by Gabriela. And Gabriela will be talking to you about that study in a few minutes. We also have a study assessing IPV attachment and emotional regulation in young adult couples in the Rio Grande Valley, mostly students at UTRGV. And that study has been done by Deanna Pollard, who I'm sure you know. And then we have another study assessing cognitive flexibility, alcohol use, and IPV in the college sample. And we have another ongoing study assessing facial emotional recognition and IPV. And Joanna Segundo, I don't know if you're familiar, if any of you know her, did a study assessing IPV perpetration in females. And she assessed about, I think it was 360 females and looked at the perpetration rates, perpetration and victimization rates in the females. Okay, so those were those is the research studies that we've been doing and are currently working on. With respect to the lab findings, this is mostly from the Illinois study. We found that lower standing on staking conformity variables, okay, income, employment, marital status, and less to lose. Okay, so the people that have lower staking conformity are more likely to recidivate. Okay, there's greater probability of having been a victim of child abuse and having witnessed parental IPV in childhood. Okay, that if you've been a victim of child abuse and have also witnessed parental IPV in childhood, you're more likely to recidivate. Okay. The generally violent perpetrators have a lower probability of treatment completion. The generally violent perpetrators have a greater probability of recidivating following probation, okay, so than the family-only perpetrators. That's the severity of violence predicts recidivism, and that treatment helps reduce recidivism if the generally violent perpetrators complete treatment, but not if they don't. Any questions on these findings? Yeah, basically, the generally violent perpetrators have lower staking conformity, meaning they're less likely to be employed, to be married, and they have lower income than the family-only perpetrators. The generally violent perpetrators also have a greater probability of having been victim of child abuse and having witnessed parental IPV in childhood. And that's associated with a greater likelihood of recidivism. They tended to complete treatment at a lower frequency than the family only. The family only perpetrators completed treatment, but were more likely to complete treatment, but treatment completion for the family only perpetrators didn't really affect the recidivism rates. The treatment completion affected the recidivism rates for the generally violent perpetrators if they completed treatment, but they were less likely to complete treatment. Okay, and so we classified the severity on the police reports, the severity of the violence from the police reports, and we were able to find that the perpetrators that had perpetrated more severe violence were more likely to recidivate at follow-up. And again, we followed the perpetrators up for 3 years past the completion of the treatment program. Okay. So does anybody have any questions about my research before we hand it over to Gabriela?
I guess I just have one general question as to was there a moment or that you just knew that you wanted to study this? Was it an experience or just the work that you do overall?
Say that again.
If there was ever a moment where, you know, can I explain it? That just made you want to do this type of research, be interested in this, or it was just reading?
Well, the way I got interested in this was, again, when I needed to get some income when I was studying my PhD, and I found out there was an opening at the Columbia Presbyterian Medical Center in New York City, and I interviewed for the position, and they basically told me they had two openings. I could work either at the family center, which was the child abuse clinic, or I could work in the suicide prevention program for adolescents. So there was a choice of two, and I chose the family center. That's where I got interested in working on domestic violence. And then at Stony Brook, I used to see clients at the marital clinic, University Marital Therapy Clinic. And Dr. O'Leary, who was one of my mentors at Stony Brook, started studying intimate partner violence. And they were doing a study looking at the efficacy of treatment of perpetrators of intimate partner violence by comparing gender-specific treatment to couples group treatment. And they asked me if I wanted to participate as a therapist. So I participated as a therapist in both conditions, doing both gender-specific treatment and couples treatment. And after that, well, I signed up to do a postdoc with them. So that's how I got interested in domestic violence in general and intimate partner violence specifically. Does that answer your question?
Yes, yes, it does. Thank you.
And then I just continued.
Thank you.
Any other questions? Okay. Well, Gabriela is now going to talk to you about the RGB high school dating ban study.
Can you stop sharing, Dr. Cantos, please? Okay. So good afternoon, everyone. My name is Gabriela, and I'm currently a PhD student with working at the Family Violence Lab under Dr. Cantos' mentorship. So I will just really quickly introduce myself and then talk about my study, what I found, what I was interested in, why I started doing it, right? So let me share my screen. Are you able to see it? It's just very simple. Can you see it?
Yeah, we can see it.
Okay, so again, I am part of the Family Violence Research Lab. And so my undergraduate degree was not in psychology. It was actually in biology and chemistry. I was convinced that I was going to go to medical school, right? And study psychiatry. So I did end up applying to medical school after my degree, after I received my degree in 2014. But then, you know, life happens. So I didn't end up enrolling in medical school and I deferred my position. So deferment just means that they'll hold your position for 2 years if you have extenuating circumstances and you're proving that you're going to do something with your time. So I decided that I was going to do Teach for America. And that's just basically, you know, a program that places teachers or it places STEM graduates into teaching positions for low-income students. So there I taught biology, chemistry, physics, all the sciences in high school. I decided that I wasn't going to go to medical school after all, and I enrolled in the master's program at UTRGV in clinical psychology. So I was able to graduate 2 years ago. That's where I started my research with Dr. Cantos. It just so happened that Dr. Cantos needed a student and I needed a mentor, so it just worked. While I was doing that, I was also working at an immigrant children's shelter, New Hope in McAllen. So I was able to see that as well. So I worked there for 2 years. And this is where really my interest in my research study began. And now I'm currently enrolled in the clinical psychology PhD program, and I was able to enter with the first cohort of 6. But this goes back to why I studied, why I decided to study. So I looked at dating violence perpetration. Dr. Cantos had been looking at adult intimate partner violence, but I was interested in looking at the adolescents. So what were the high school students doing? What were their characteristics like? Was the research similar to that of adults? And because I had worked in a high school setting and been a teacher for 3 years, I was really interested in this. So just recently, we were able to publish our research. And this is the title of our paper: Is all dating violence equal? Gender and severity differences in predictors of perpetration. So basically, I wanted to look at perpetrators of intimate partner violence in high school. So 14 to 18 years old students. So this was basically what we did, right? There were 6 high schools throughout the valley, and there were a total of 407 students that we gave self-report questionnaires to. And there were more students, but only 407 were the ones that said that they had been in a relationship for the last 12 months. So those were the ones that we were interested in. And what I wanted to know is, did adverse childhood experiences, so basically things like seeing the parents hit each other, low socioeconomic status, maybe abuse in the home, all these things, right? It's a questionnaire of 10 different things. Did that affect if a high school student was going to hit their partner, or exposure to interparental violence? If you saw your mom hitting your dad or your dad hitting your mom, were you likely to hit if you were in a relationship in high school? Also, attachment. If you were insecurely attached or avoidantly attached, were you more likely to hit? Emotion regulation and impulsivity. So if you were very impulsive and just did things out of nowhere, were you more likely to hit your partner? So those are all the things that I was interested in. However, yes, Dr. Cantos.
Gabriela,
Yeah.
it's important to note that you had to interview 829 students
Yes.
to be able to get 407, right?
Right. So, and that in itself is a lot of good data, because it shows you that if you were to interview 1,000 students, only about half of them, a little bit less than half of them, are going to be in a relationship. So that was data that was important, right? And since this study or something like this had never been done in the Rio Grande Valley, it was also important to see, okay, is a Rio Grande Valley different than, maybe studies done in Illinois or studies done further north of the United States? So yeah, like Dr. Cantos mentioned, less than 50% of all the students that I interviewed were in a relationship in the last 12 months. So instead of looking at 829 pieces of research, I was only looking at 407. So it did take a very long time, but it was completely worth it because we found a lot of things that were important. So are there any questions so far with, the way everything was set up? We went to a lot of high schools. There was a lot of students. No? Okay.
How did you interview the students? I'm guessing this was way back before COVID, right?
Yes. So I don't know what that would look like post-COVID or during COVID. But it definitely, what we would do is take whole classes of students into a computer lab that were interested in that had signed the consent form, right? The parents had signed the consent form if they were under 18. And so they were in a lab, maybe spent about between 40 minutes to an hour and 15 minutes finishing this. That probably wouldn't be possible now because there would be about 20, 25 students in a room. So I don't know what that would look like now. Probably links that they would do on their own, maybe. Yeah.
Yeah,
But
Qualtrics before. That's what I'm working as a research assistant for the school, and that's what pretty much what we're doing, just Qualtrics. But
oh, okay. So you're currently at a high school now?
no, I'm working as an undergrad assistant for the Department of Biology. But we do like a sense of belonging survey pre and post during the semester, and before COVID, it was with you know in person, and now we are doing it sadly on Qualtrics, but it's a lot.
Yeah, yeah. So they weren't actual interviews. It was done through Qualtrics, but
Oh,
we were there in person with them.
oh, okay.
They weren't, so they would finish and then, we would see that they would finish and then they would leave.
Oh,
Um, but everything was done through Qualtrics. So I have been thinking about continuing research with with adolescents, right? Kids in high school. But that is something to consider. Like, okay, what are the precautions that you're going to be taking now with COVID? But so basically, what we did is our big scale that we were using, the one that we utilized to see what kind of violence they were perpetrating, whether it was emotional, physical, sexual, was called the CADRI, right? And it's CADRI. It's basically an acronym, right, for this widely used physical abuse scale. And from this scale, there's 5 different subscales, right? And the one that we looked at for this paper was physical abuse. And here, one thing that we did was categorize level of severity. First of all, there had been no research done in the Valley with high school students like this. Second of all, there's not a lot of research that categorizes abuse based on severity. So pushing someone is not the same thing as punching them, right? So we wanted to see if there were different variables associated with different levels of severity. So we separated it into 3 different levels. So the first one, all 4 items, was looking at all of the items together, all the types of severity together. Then we had category 1, which was looking at the minor to moderate severity. So pushing somebody, throwing something at somebody, slapping or pulling their hair. And then the last category, category 2, just looked at the more severe item, kicking, hitting, or punching. So what we wanted to see is at each category, were there different indicators predicting that an adolescent would be more likely to physically abuse their partner in a relationship. Does that make sense? Okay. And this is great because you were separating the severity, right? Like I mentioned, kicking, hitting, or punching is completely different from just pushing, shoving, or shaking. So we would know specifically if there were differences, somebody was going to end up doing something really, really bad. And again, these are just predictors, right? So it's not going to tell us if they're for sure going to do it, but it gives us a good estimate. So this was my sample. Males and females were about half and half, 46 to 53%. The age here, you can see that 17-year-olds were the highest percentage, but they were still pretty divided up very well. Then you have the grade. We mostly had 31% were 11th graders, and then 88% were Hispanic. The rest were white, Caucasian, I'm sorry, and then one participant in the 407 sample identified as Asian. So we had that, and so we grouped them together, and then mostly spoke Spanish and English about equally, and then the other 3 were a combination of Russian and Mandarin. So, okay, let me show you our findings. And then if you have any questions, So here is our paper, right? And what we were able to find, are you able to look at this?
Yeah, we can see it. Mhm.
Okay, so what we found that was very interesting is that females reported more perpetration of dating violence at minor and moderate levels of violence than males, but not at levels of severe violence where reports were practically equal, right? So basically what that means is that when you asked a girl in high school, right, are you perpetrating violence in the minor and moderate, right? Which is not punching, hitting, whatever. They were more likely to say that they were perpetrating more violence than their partner. So females were saying, yes, we did these things a lot more than they did it to us. Okay. However, when we looked at severe perpetration, both of them were saying it was about equal, that they were both perpetrating severe violence. Okay. So perpetration of severe violence here with the severity of violence perpetration, taking into consideration the perpetration of different severity levels within gender, male perpetration of severe dating violence is substantially higher than that of females. Okay, so of the total number of males that said, yes, I'm perpetrating violence, 59% admitted to perpetrating severe violence, where only 27% of the females perpetrating any type of violence admitted to perpetrating severe violence. Does that make sense, like the findings? So one of the things that's important here is that usually when we think of violence, right, and one of the things that has been said a lot is, you know, males are more likely to perpetrate violence, right? A lot of research has shown that it's not that way, but it's still one of the things that we think about. There's not research here in the Valley specifically, but people think, oh, well, males are the ones that perpetrate violence. In this research study, females were the ones that were saying, oh, I perpetrated more violence than my partner, which was different, right? And with severe violence, both were saying that they were perpetrating the same amount. So when you think of hitting, punching, hitting and punching, right? You think, oh, okay, well, males are more likely to do that. Well, both males and females were saying that they were perpetrating about the same. So that was very eye-opening for us. We have other results, but I think these are the ones that were the most eye-opening, I guess, more interesting. And we looked at other variables, things like that, and we did find a lot of good data. But I can send over the paper if you guys are interested in looking at that. And it's 1:58, so if you guys have any questions, I'll take questions now. It's a lot of information, so.
Yeah, so the results were actually pretty interesting. So do you have an idea as to why females are just admitting that they perpetuate more violence? Do you have a hypothesis or something? It's just interesting, really, to see because, like you said, it's usually we think of males as the ones that are more violent, and it turns out here in the Valley, that's not the case. So,
Yeah.
Again, you need to take into consideration that they're not saying they're perpetrating more violence. What the paper, what this study finds is that they're perpetrating more minor and moderate violence. Right?
mhm.
So minor and moderate violence is maybe a slap,
Pushing.
pushing, slapping. So they're saying they're doing more of that than the males. But when we consider severe violence, the rate of perpetration is equal, right?
Yeah.
Go ahead, Gabriela.
It's a very loaded question. I think that females are more likely to maybe push their partner, or, you know, throw something at them or something, than males. Pulling hair, things like that. Those are things that, you know, maybe females are more, and, you know, they said that they're doing that. But as to the severe violence, I don't really have a hypothesis as to why, you know, my sample um, was saying that they both did it about the same. The only thing I can think of is that maybe it was bidirectional. So one hit the other, and then that person hit the other person back. And so they were hitting each other, but it was mutual. One thing that's important too is that I wasn't looking at couples. I was just looking at, you know, individuals. So maybe if I was looking at couples, I would be able to see what is really going on. Were they both hitting each other? Was it just one person? Things like that. But it's interesting, and it does require more follow-up. So it would be interesting to see what we would find in the future.
Diana Paula's study is not with high school students, it's with college students. But in that study, Diana looked at couples. So we are looking at the perpetration within couples, and we can look at the degree of concordance in what they said, both of the male and the female. Okay, so
Yeah. So it's definitely, this is very exploratory, right? But the data was great, and adding on to this would be great to find out those variables, like, okay, what is really happening? Maybe adding different measures to see what they're thinking. That would be another one too. Like their thoughts on violence, what they think of with regards to that. So yeah, the future.
After COVID.
any other questions from anybody?
Anyone else have any questions before we end the session? Because I know it's already past 2. So
Yeah, I'm going to put my information. Oh, I didn't add it on here. So I'll put my information on here. Actually, I'll share my information on the chat, my email, and our our family violence lab URL. So in case you're interested in looking at or getting more information as to what we do, the people in our lab, you can definitely reach out. You have questions, there's a question form on there where it will be sent directly to Dr. Cantos or myself, and we can reach back to you from there. So definitely one thing I can suggest is, a lot of you are undergrad, right? Being a part of research will definitely help you decide what it is that maybe you want to pursue and if it is the right thing for you. So I knew that medical school wasn't for me when I started doing research in my master's. So I was able to go the route that was more appropriate for me. So had I not done research and pursued that, then maybe I would have been doing something else right now. And I don't know what that would be like.
I do have a question. Are you currently recruiting any new assistants, or are you planning to recruit anyone for next school year? Our members are usually looking for new opportunities, so it will be good to let them know.
Yeah, so one of the things that we look for is people that are interested in what we're doing, right? And they usually email Dr. Cantos, or there's a form on that website, and they can reach out, and we can see what kind of things they're interested in and what kind of research they can be a part of. In our lab, there's always a lot of things going on. So there's a lot of opportunities for that.
In our lab, we're interested in people that want to participate in the ongoing research and want to help out with the research, to learn about how to do research. But I'm also particularly interested in students that want to do their own research as well within our area, like Diana, Gabriela, okay, so and Joanna, who have developed their own research and done their own research. Okay, that's I highly value that, and that's what the kind of student that I I like. Okay.
Mhm. Thank you so much for that information. I'll go ahead and pass it to the members that couldn't be here today. Anyone else have any questions?
Okay.
I have a question. So you mentioned undergrads. If you recently graduated, can you still try to apply to be in research projects?
We've worked with undergrads that have graduated, right? We are able to do that, right, Gabriela?
Yes, if they're working on a current research study, the IRB has this document that allows them to continue. Mhm.
Okay.
Yes,
Thank you.
and we have had somebody do that before.
Anyone else? Any questions?
I have one question. Hi, my name is Andrea. I am the public relations officer for SAR, and I'm also an undergraduate psychology student. Would you guys study, or would you guys, you mentioned that you would be open to looking at things that are you look at. Would you, have you ever considered studying things PTSD for survivors of domestic violence, or health outcomes for survivors of domestic violence, or things of that nature?
Mm, you're asking if we are interested in looking at PTSD in survivors of in IPV?
Yes.
Yes, sure. That would be something that we would be interested in looking at. Mhm.
Okay, yeah. I was just wondering, because like there's actually quite a lot that you guys could research and a lot of things that you investigate in the lab. So thank you so much for coming on here and letting us know.
Okay.
Thank you for that, Andrea. If no one else has any questions, then we can go ahead and close down the session for today. Thank you so much for everyone that came in and had a chance to hear about Dr. Cantos' experience, his life, and his history. So thank you so much, and also Gabriela for being here. We really appreciate it. Like I said, the session was recorded, so we'll go ahead and post it by tomorrow in our website in case y'all would like to look at it again.
Okay.
Well, thank you so much again, and y'all have a nice rest of the week. It's almost the end of the semester, so let's keep it up.
Okay. Bye-bye.
Bye.
Thank you
Thank
for
you.
asking us to come.
Bye.
Bye.